Hi, I'm Heidi Otway, your host for this Conversations on Cannabis virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about marijuana as medicine. So let's learn and talk about this subject with our distinguished panel of doctors. We have Dr. Janice Knox, a board certified anesthesiologist, best selling author, and cannabis expert. She is the co-founder of the American Cannabinoid Clinics, as well as the vice president of the Association of Cannabis Health Equity and Medicine, also known as ACHEM. Dr. Knox, tell us a little bit about yourself.
Thank you. First of all, I want to thank everybody for allowing me to participate in this panel and being with Dr. Kaya and Dr. Wilson-King. Thank you all. I'm Dr. Janice Knox, as she said, a board certified anesthesiologist, but more importantly, I'm an endocannabinologist. And what that means, that's new language, folks. What that means that we study the science first, the physiology first, then apply botanical medicine to that physiology. I'm a member of a family of doctors called the Knox Docs. That includes my physician husband and two daughters, Dr. Rachel and Dr. Jessica. We also have something called Pivotal EDU, which is our training program for healthcare providers so that they all understand endocannabinology and cannabinology as they work together. And then also the American Cannabinoid Clinics is where we actually see patients. And I've seen thousands of patients over the last few years as an endocannabinologist. And I'm from Oregon State.
Thank you. Our next panelist is Dr. Kaya, a board certified emergency medicine physician who is bringing wellness to people through cannabis. Dr. Kaya, tell us about your work with 40 acres and a dispensary.
Sure. Again, thank you for having me here today. It's awesome to be among such great Black women physicians that we have on the panel here today. And good to speak with Heidi. But yes, I definitely myself believe in the medicine of cannabis and the ability of cannabis to not only heal people, but the ability of cannabis to bring in economic resources that can decrease health disparities of all types in the Black community. So 40 Acres in a Dispensary is an effort to actually do just that. We're teaching the Black community about the vast opportunities in the cannabis space so that we can get in a real way and build some generational wealth. So we provide quite a bit of education, a little bit of entertainment and motivation, but a lot of programming with webinars and information and coaching sessions so that we can get in as a community as a whole.
Thank you. And rounding out our panel is Dr. Genester Wilson-King, a board certified obstetrician and gynecologist and nationally recognized speaker on cannabis use and wellness. Dr. Wilson-King, you're involved in a number of organizations around the cannabis industry. Can you tell us a little bit more about this experience?
Sure. I want to echo the sentiments of my other two physicians. I am just really honored to be among the best of the best on this panel. And I'm glad to be here to help FAMU in all of their efforts. I am a Florida physician, and after years of providing a full service OBGYN practice, I founded Victory Rejuvenation Center, which is a private, holistic, and integrative wellness practice. And I provide life transforming management modalities, which they are, and customized medicines to my patients. We assess where patients are on the health and wellness spectrum and then help them create an individualized program which enables them to get to where they want to be on that spectrum. I am also vice president of the Society of Cannabis Clinicians, which is a nonprofit organization that works to empower and educate healthcare providers on the use of cannabis medicine. We have a wonderful cannabis clinical training curriculum that has just been launched, and you can go to our website, cannabisclinicians.org, to find it. I'm also the co-author of a third one is pending, two publications, research articles on the assessment of the impact of cannabis on female and male sexual function.
Oh, interesting.
So I'm in.
Thank you.
Thank
Thank you
you.
all for being guests today. And to everyone joining us on this live forum, Please share, post, and tag a friend on Facebook to have them join this conversation with us right now. And if you're on YouTube, share the links so others can join us as well. During the forum, we want you to send us your questions about cannabis as medicine in the comment box, and we'll do our best to have our panelists answer them, or the Mary team will respond to you in the comments. We also want you to tell us what you think about this forum by completing the survey that will be posted in the comments. When you complete the survey, your name will be entered into a drawing for tickets to an iHeart music event courtesy of our partners at iHeartMedia. Now, let's dive into our conversation about marijuana as medicine. So, doctors, all of you are involved in the cannabis health equity movement. Dr. Kaya, can you tell us about the movement and the Association of Cannabis Health Equity and Medicine, also known as ACHEM?
Yes, definitely. So the movement we refer to as CHEM, Cannabis Health Equity Movement, and that is basically an effort to make sure that we as BIPOC community are able to be a strong part of the cannabis industry. We're able to create health equity within our community, utilizing cannabis. And we have a lot of moving parts to the organization. One of those happens to be ACHEM, and that is actually a professional organization that is actually just launching on Saturday. So anyone who is a healer, a professional healthcare worker who would like to come and join us, we definitely welcome you to join us and check us out at ACHEM ED. I'm sorry, yes, ACHEMED.org. So you can find out a little bit more about us. But we basically want to make sure that health professionals and healers from our community are educated about cannabis medicine. We also assist with making sure that you get job and career opportunities within the space. We help you become advocates within the space to create health equity and advance cannabis medicine and treat patients that we see from our community and other patients in a real and effective way when it comes to cannabis medicine.
Okay, Dr. Knox, you are a co-founder of ACHEM. Is there anything else you want to add?
Yeah, I think one of the main things that we've seen, especially since COVID, is the healthcare disparity gap that we witnessed in our community.
Yes.
And what really pointed out was that we do get a different level of care. And we have so few people look like ourselves that we're not real trusting. So ACHEM is trying to fix that. How do we help our folks have trust in this space that they've been stigmatized, and the war on drugs have sort of put us in a position where we're really leery. So having physicians who are trained in cannabinoid medicine, understanding endocannabinology, is imperative to our people. Our people are the last ones to find out and to benefit. One of ACHEM's goals is to change that narrative.
Great. And we're going to post the link to ACHEM in our comment box so people can have access and learn more about the organization. So all of you specialize in medical marijuana, and I've seen each of you talk about cannabis and its effect on the endocannabinoid system. And Dr. Knox, you talked earlier about you being an endocannabinologist. Did I say that right?
You did. Beautiful.
So,
very well done.
Can you tell us about the endocannabinoid system and what is its role in our bodies?
Absolutely. And I want to let you know first, we were not taught about this in medical school. And it is one of the most important physiologic systems involved in establishing and maintaining human health. It consists of endocannabinoids. Those are endocannabinoids that our body makes, endo meaning within the body. Then there's receptors, and a receptor is you think of the receptor as a lock and the endocannabinoid being the key that opens the lock to whatever else needs to happen. So you have the endocannabinoids, the receptors, and the proteins that are needed to synthesize or create and break down the endocannabinoids themselves when they have done their job. Now, endocannabinoids are created when they have, in response to cellular stress. It's an adaptive response. Exercise, injury, and their goal is to reestablish cellular homeostasis. The endocannabinoid system is involved in helping us to relax, to eat, to sleep, to protect, to forget, and the all important balance in our bodies. So the cannabinoids from the cannabis plant, which are called phytocannabinoids, and other cannabinoid constituents, utilize the endocannabinoid system and other receptors to affect a change within the body. That is the endocannabinoid system. And it is a system that we are trying to get everybody to know about because it is the all important system. Now, we were taught that the runner's high, if any of you have experienced that, like if you exercise really vigorously, the runner's high, we were taught was due to endorphins. And endorphins may be a little bit involved, but it's really the production of the endocannabinoids that's providing that lovely response after you exercise hard and you feel really good. Those are the endocannabinoids. They are very, very important.
That's very interesting. Dr. Knox, Dr. Kaya, do you all want to add anything more about that?
Yeah, I think I just want to add a little bit. We look at now the endocannabinoid system as being a smaller part of a bigger system, we call it the hyper system, a signaling system that's called the endocannabinoid because we know the endocannabinoid system doesn't run in isolation. There's other receptors and other ligands or neurotransmitters that are involved. But the bigger picture is that the endocannabinoid system is affected by different kind of cannabinoids. We have the endocannabinoids that Dr. Wilson-King spoke about that the body makes. Then we have what's called the external cannabinoids, and those are synthetics, and those are the phytos. The synthetics we know, like Marinol or Dronabinol, that you can get a prescription for. I can write a prescription for those for patients. And then there are the phytocannabinoids, cannabis, and some other herbs that work on that system. So there's lots of things that work on that endocannabinoid system in total. That's the reason why endocannabinology is so important, because the more we learn about the physiology, the better we are to apply cannabis pharmacology or any other herb or botanical to this system. And we'll talk a little bit more about that later.
Okay. Dr. Kaya, can you talk with us about how cannabis works on the endocannabinoid system and our bodies?
Yeah, sure. And that the cannabinoids, which are part of the cannabis plant, the cannabis is made up of several natural chemicals. Inside the cannabis plant, we have cannabinoids, which actually has the medical properties. You have terpenes, which actually give the aroma to the plant, but also actually have some medical properties as well. You have flavonoids, which gives color, and it's still a little bit up in the air how much medical benefits the flavonoids have. But the cannabinoids, when we think about just those particular products, there's a lot of them in the cannabis plant. About 150 have been identified. And what they do is they act similarly to the cannabinoids that we already have in our body. So some conditions are actually thought to be a result of cannabinoid deficiencies in our body. So if you have a deficiency of something, you usually take a supplement of it. So like when we have vitamin D deficiency, you usually take a vitamin D supplement. So it's thought that cannabis can actually help by providing more of the cannabinoids that you're missing in your body. But it actually gets a little bit more complex, it gets to be quite a bit more complex than that, because the cannabis plant and those cannabinoids actually can act as a check and balance system. So it can actually come in and say, okay, your body has too much going on. It has a lot of inflammation going on. So what we're going to do is we're going to send another signal so that some chemicals can be released that say, calm down, stop all the inflammation. You have lupus, and that lupus means that there's a lot of inflammation in your body, and we need you to calm it down. So that's why it works in some inflammatory conditions. And on the opposite end, it can actually say, hey, you don't have enough of something going on. We need you to rev it up. So it can actually bring about quite a bit of balance. And that's one of the reasons that it has an effect on so many different disease processes. And the other reason it has such a great variety of effects is that it can actually act, those natural cannabinoids from the cannabis plant, those phytocannabinoids, can actually work on more than just the endocannabinoid receptors. It can actually work on other receptors in our bodies as well.
Wow. Well, you just talked about a couple of different medical conditions, and here in Florida, for someone to qualify for a medical marijuana use card, they have to have one of the qualifying conditions. So, Dr. Knox, I wanted to ask you, in your practice, you treat a lot of people with different medical issues that they have. How can cannabis address so many different physical issues, ailments with people?
That's a great question, one we get quite a bit. First of all, a lot of people don't want to believe that cannabis can do so many things, this miracle plant. But once again, I'm an endocannabinologist, so I'm always looking at it from the cellular and subcellular level. So when a patient comes into me with a particular disease process, I'm going to look at which organ is involved and what are the receptors there that I need to pay attention to. For example, if I have a cancer patient, a breast cancer patient, that's a lead cannabinoid. It's going to be my CBD. If I have a patient with a GI problem, then that lead cannabinoid is going to be CBG and then beta caryophyllene, one of the cannabinoid terpenes. But it all has to do with really understanding that physiology and which receptors are involved. One of the problems I do see now is that CBD has blasted the market, and people think CBD can do everything. Well, CBD is a wonderful cannabinoid, and it does do a lot of things. Does it better with a little bit of THC involved, but CBD does not work. It works indirectly on that endocannabinoid system. So what it does, it blocks one of the enzymes that break down anandamide, which is one of the endos, so in higher levels. So it works indirectly. It can also change the configuration of that receptor so that THC doesn't bind as well. But the beauty of CBD is that it works on 65 other different receptors. Wow. And these receptors are all over the body. So when we go in and look at a patient and why we can treat so many disease processes, because we know which receptors are involved, we know which cannabinoid or terpene profile we need to address. So we can get pretty specific for diseases. And as the research goes on, we're getting even more specific. And we call that the N of one, the study of one. How do you respond to your therapy, whether it's conventional therapy or traditional medicine like cannabis? How are you going to respond as a person? So each individual is really precise, what we call protocol to follow. These are the cannabinoids I want you to go out and look for. These are the terpenes I want you to look for, because we can look at each individual disease and figure out which cannabinoids we need to use. It's getting that precise. Wow. And once again, those receptors are all over the body. Every organ, every system. Right. Your skin has its cannabinoid system, your GI tract, everything has its system. So it's everywhere.
Yeah. So I was going to ask you, I wanted to follow up on that.
Sure. As my esteemed colleagues on this panel have already so brilliantly stated, there are multiple compounds in the plant, in the cannabis plant, and they work synergistically. And what that means is 2 + 2 does not equal 4, it equals 8 when they all work together. So there are many different substances in the plant, and this makes the therapeutic window very wide. The less substances you have in a medication, the more narrow the therapeutic range is. The more substances that will act and do things around the body, fulfill a lot of the receptors, the wider the therapeutic range. And that means that if you use single molecule CBD, it requires higher doses. But if you use whole plant CBD, it requires lower doses for the same effect. Mm-hmm. This is the way botanical plant, botany means plant, this is the way they work. And it's really, we're only at the surface of characterizing this plant. And as Dr. Kaya said, the terpenes, the flavonoids, the fatty acids, all of these substances have a role, and we're really still trying to elucidate all of it. Mm-hmm. And actually, traditionally, the people have used whole plant products to treat their diseases and conditions. The single molecule product has only been created in the last 75 years.
Okay, we're getting some questions about CBD, and I have several questions myself because I mean, I've traveled, pretty frequently before the pandemic, and every store that you would stop in, from a 7-Eleven to, the grocery store, has CBD products on the shelves. And like Chris just asked, one of our audience members, how do you know which CBD is the best? How do you know what to choose?
That's a great question.
Yeah.
Great question.
Well, I guess I should should I answer, or how do you want to do this?
Dr. Kaya,
No worries. I can talk a bit about it.
Yeah, Dr. Kaya.
Okay, so yes, with the points that we've actually been talking about already, Dr. Janice and Dr. Genester told us quite a bit about these cannabinoids and how they work. One thing to understand as well with that, when you're thinking about what products are best for you to get, one thing to understand is there have been identified over 50,000 varieties of the cannabis plant. So these different varieties can actually work in different ways. So you may have a certain percentage of CBD in one product, a certain percentage of THC, a certain percentage of CBG, CBN, and that's a different percentage that you have in another plant, and you have different percentage of terpenes. So each one of these can, and the different percentages of the components of the plant can actually function differently. So you have a whole pharmacy worth of medications instead of just one medication. So as Chris was asking, it gets hard to determine, like, okay, I'm a patient, which one of these 50,000 do I just go out and buy? Because, my physician didn't write me a prescription that says, go get this exactly. So it is very hard, and it is something that we have to actually do a little bit of experimentation sometimes with. A very experienced cannabis physician can actually point you in the direction of which cannabinoids and which terpenes you should be looking for which illnesses. So I do recommend that you actually have an experienced provider that can lead you in that way. And then you can actually make alterations and change based on the effect that it's actually having for you. And you can do a little bit of that experimentation because cannabis in general is a very safe medication. I mean, absolutely anything can give you side effects. If you drink too much water, you can have brain swelling if it takes a lot of water. But it's important to realize that we have to look at everything individually. And so you can use cannabis, and with an experienced provider, they can walk you through making changes. But which CBD is best for you will depend on what's going on with you as a person, which disease processes that you have going on in your body. But one thing to really be concerned about is making sure that the product is a pure product and doesn't have the contaminants in it that we look for. So that's a long list. I don't want to get too far into it, but it can be pesticides, it can be heavy metals. Heidi, I saw your eyes get really big there. But actually, cannabis is a plant that actually draws up impurities. It draws up impurities from the soil because it cleans up the soil.
Bioaccumulator.
So you have to.
Bioaccumulator. Yes.
Yeah.
Yes.
So you have to make sure you have a well-tested product. So it's not just about testing, okay, how much CBD does this have? How much THC does this have? How many terpenes does this have? But it also should be tested to make sure there's not residual solvents there from the processing that it's gone through, if it's not just flour, but it's actually a product that's been processed. And you have to look for those contaminants like microbes and toxins, heavy metals, pesticides, things like that. So it's important to get a well-tested product.
Right.
Yeah, so that means,
and that's one of the things.
Stores, they probably need to ask a lot of questions if they go in these CBD stores that are on every corner nowadays. These are great questions to ask.
Well, let me add something to that. Certificate of analysis. Those three words are very important if you want to purchase any type of CBD or even cannabis product. And what one good thing is about the state of Florida is they require that testing on all products. So if you're going to go into a store at the gas station and purchase a CBD product, there should be a QR code on the product which you can put your phone on and scan and see what's in that product. If there is no QR code, don't purchase the product. If there's no certificate of analysis available for you to see, if the product has maybe the website on it, and you go to the website and there's no certificate of analysis, you shouldn't purchase that product. But the certificate of analysis, COA, is what you want to look for to find a quality product.
That's great advice. So medical marijuana in Florida is legal in Florida. And last year, as you can imagine, during the pandemic, the medical marijuana use card approvals skyrocketed in the state. I mean, they just went off the roof. So I wanted to ask you, I want to let everyone know who's watching the program that we encourage you to go to the Florida Department of Health's Office of Medical Marijuana Use to learn what the qualifying conditions are in Florida to get approvals for a medical marijuana use card. And they also have the list of all the doctors in the state of Florida who are approved to recommend, because in Florida, they recommend, they don't prescribe, but recommend cannabis for you to get from a dispensary here in the state of Florida. So that kind of segues into my next question.
Or just call Dr. Wilson-King, right? Or just call Dr. Wilson-King, right?
You're on the list. Is that right, Dr. Wilson-King?
I am. I'm a cannabis clinician.
Right.
Yes, I am.
So that's great. Great to have you on the list. And you all touched on this just a little bit, but you talked about the chemovar of cannabis and how people should decide what should they use for their condition. When people come to you with a medical condition and they're considering cannabis, how do what would they experience with you? What to help break the unknowns.
Let me get started there. When patients come in, invariably, they're curious about the products that they're buying, and they'll tell me they're on Blue Dream or Kush or a sativa or an indica. And those are well and good, and that's the language in the community. But I, as an endocannabinologist, have to ask them, what's in your sativa? What's in your Kush? What are you buying? Because what's really important, this goes back a little bit to the last question, is how well you teach your patients how to read those labels. Those labels should have a COA, or that QR code. It should tell you the cannabinoids that's there. It should tell you the terpenes is there. So instead of thinking cultivars, we think chemovars. What is the chemical makeup of your product or even that plant?
Yes.
So we want to know specifically which cannabinoids or which terpenes, which flavonoids that are in there, and anything else that may be in that bottle. And so I'm constantly telling patients, read the label. If you don't understand the label, send the label to me, because what we're going to send them out to buy is not Purple Dream. I'm going to send them out with a specific cannabinoid profile, a specific terpene profile. I want them to understand their ratios that they're going to start with, which is very important, because if you start a patient who's really naive with a 1-to-1 or something like that, they're going to feel that THC. So we're usually going to start them like a 10-to-1 or 20-to-1, anything greater than a 4-to-1. So they have to understand what the ratio means. They have to understand what the milligram content of their product is. For example, if I have a patient that has cancer and I need them to have a high dose of some cannabinoid, I don't want them to buy a product that has 5 milligrams per 30 cc's. I need them to buy, because they're gonna have to drink like 10 bottles of something to get 1 dose in.
Yeah,
exactly.
So we have to train them how to read those bottles, those labels, so that we send them out to buy specific cannabinoids. Remember, I'm not going to send them to buy a strain name. I'm not going to send them to buy sativa or indica. I'm going to say, this is what you're going to look for. Take this to your dispensary and give this to them so that they know. Now, if those ingredients happen to be in that Kush or that Purple Dream, fine, but tell us the chemical profile. That's really important when we're treating disease processes. Again, when you look at a disease process, you're looking at the organ, which receptors and which cannabinoid is best for this receptor that I need to take care of. And that's how we distinguish between using the cultivar versus a chemovar type of thinking.
Absolutely.
Okay. Dr. Kaya,
And Heidi, that's
follow up.
Just really quickly, because Dr. Janice explained that beautifully. Just really quickly, I just want to add that that's important. What she said is very important for when you're traveling as well, because when you travel to another place to find a medication for yourself that has similar effects to what you had before, that's what you need to be looking for. You need to be looking for the chemical composition breakdown.
Right, right. And that's why knowing the certificate of analysis and knowing about the product that works for you, you can easily look for that whenever you travel. It's so helpful. And if the chemovars that Dr. Janice so brilliantly described are type 1, type 2, type 3. It's real easy to remember. Type 1 is THC dominant. Type 2 is the mixed ratio, like the 1-to-1s. And type 3 is CBD dominant. So that can guide you as to what direction you need to go in when you're searching.
So Dr. King, let's say someone they know nothing about this. They don't know the sativa to the indica to the CBD. They just know that they are not well and they want to learn if cannabis is right for them. What would they experience when they would come to your practice, just not knowing anything? And they've never bought a product. They don't know what Purple Gorilla is or all these other amazing names that you guys just
names. Crazy names. We get them too. Oh, we get them.
Those names can really be out there. That's for sure.
I've heard crazy ones. I've heard
well,
Strawberry Switchblade. I mean, I'm like, what?
Well, we're trying to, the science and medical community are trying to get people away from those names like, skunk and train wreck and things like that, and get to look at it from a more medical or scientific perspective. What we do, first of all, I want to say this: cannabis isn't the end all, and that isn't the only thing that we're going to look at. You start with an assessment of the patient. You get a medical history. You treat them as a person. You look at their home life, their work life, all their spirit who has a soul that lives in the body. So we want to do a really involved history and then a basic physical exam and just see what we need to work with. And we'll make recommendations such as, well, if we're just going to look at just cannabis, but I'm going to look at your lifestyle habits. Let's talk about what you're eating, what you're putting in your body, what you're doing with your body. Are you moving? Are you enjoying life? Are we laughing and thinking every day? All those things are really important because you don't want to if you use cannabis, yes, you'll feel better, but to optimize the therapeutic value and benefits of cannabis, if you do all the other things, such as your nutrition and your lifestyle, and what do you do for stress relief? Oh, stress relief. Coming out of 2020, there's a lot of stress that needs to be relieved. That's how we approach it, and then we decide what cannabis product. When we get to the cannabis product, we talk about what the cannabis product. You talk about what form do you want to use? What form is best recommended for you to use? I don't generally recommend smoking, but if that's the only way, if that's what you're used to and that's the only way you're going to medicate, then yes, go ahead and smoke. But there's all sorts of ways. There's tinctures, there are capsules, there are gel caps, there are sprays, there are edibles, and we cannot forget the topicals. The topicals are just wonderful agents. You have an arthritic joint, arthritic knee, ankle, elbow, put a topical cannabis cream or lotion on it. Oh, immediate relief.
I have family members who have a medical marijuana card and they swear by the topicals.
Yes. The only negative about the topicals is that they don't last very long. So you have to apply it several times a day, but that's okay. You get relief.
Yeah,
So
yeah.
yeah.
So let's talk about, I'm black, and I just mentioned that my family members.
What?
Are you black?
Yes,
Really? Oh wow. I'm
I
glad you told me.
am. And my family members have gotten the medical marijuana card. But, in the Black community and BIPOC, we're trying to get more of them to consider medical marijuana as an alternative to all the other stuff out there, the opioids and everything. So, what are ways, and this is actually a question we got from Leroy, who sent the question in when he registered for today's forum. He's asking, how do we decrease the negativity regarding using marijuana for medical purposes, medicinal purposes, especially in the Black community, Black and Hispanic
Mhm.
communities?
Let me start off by saying some
Mm.
couple of things there. I think, yeah, we've been very hurt by the war on drugs, and
Yes.
and I like to explain what I think people of color have is PTSD, whether they realize it or not. But I call that post-traumatic slavery syndrome.
Yes.
Anytime you have to send your child out and counsel your child how to act because you're afraid they're not going to come home, we're suffering from something. And we're fear, and it's still happening that people of color are arrested twice as much, even with some of the laws changing from having cannabis possession. So we need to get across a lot of barriers that our people have. Spiritual, some of them have religious, objections to the use of cannabis. Some of them have fear, lack of
Hmm.
trust. All those things is what our community has. In my mind, it's always going to start with some education, a little bit of education about their history. Let's review your history. That you, as slaves, or slaves, Black people as slaves, grew cannabis. So we have that history. We know how to do that. But how we suffered from the war on drugs when that went down. And when
Hmm.
people understand that they've been cheated out of something, then they're going to listen a little bit closer because they get
Yes.
angry. They get angry.
Yes.
And so understanding that history so we can build the next level of understanding on is critical. And then talk to them about some of the diseases that bothers us, cancer, diabetes, high blood pressure, obesity, and how that's killing us because we're depending on conventional medications that at best, I think, cover up and just treat the symptoms. When you have high blood pressure, your blood pressure medicine is taking your blood pressure down, but the underlying process continues. We can get
Hmm.
that underlying process
Mhm.
by using cannabis or other botanical medicines because we understand where they work. So I think getting that across to our people and not just the health aspect of it, but what could be the possible financial, economic benefits? Tell them this, you can get some money out of this. We're going to hear that, right?
That's
Legally,
right.
legally,
That's
and that's
right.
the key is legally, right?
Yeah, and there's a tremendous amount of happenings if we understand how to take that cannabis conversation into our communities, into our churches, into our schools, into our businesses. If we understand, in my mind, cannabis has put a big crack in the door for tremendous opportunities that people of color need to get because everybody else is getting there. How do
Right.
we continue to be last, whether
Yeah,
it's health
Right.
or economic, any of that, we need to get there.
Right.
yeah, yeah.
Yeah,
Yes.
definitely,
Yes.
definitely.
There are far too many of our Black and brown brothers and sisters incarcerated for a joint. Just absolutely outrageous. And this is a medicine that in the United States in the mid 1800s was the most widely prescribed, and it was prescribed back then, the most
What?
widely prescribed medication in the country for many, many years until the advent of IV medication, and then came the racial and just mean and hateful campaign in the 1930s to rip, and I mean rip, cannabis and hemp from our society.
Yeah.
And they were successful in doing that by the Marijuana Tax Act of 1937. And
Mm,
then cannabis was removed from the US Pharmacopoeia in 1942. Now, for something to be removed, that means it had to be on there. So it was on the list of medications in this country for many, many years until the 1930s and all
Political
the
motivation.
political and racial
wow.
just catastrophic
Mhm.
uh, and lying about the plant
Yes.
was done.
Right.
And we're about at now the fourth generation removed from that. And during all of those years, we've seen diseases that we didn't see before because we used to be a hemp based society. All
Wow.
of our paper was made from hemp. We made boats, houses, all sorts of things from hemp. We ate hemp peanut butter. We cooked with hemp oil. We used hemp seeds. Hemp was a part of society, and we don't know what taking it, well, we're seeing what taking it away has done. We do know what
Yeah,
taking
we
it
know.
away
Yeah,
can do. We know. And that
yeah.
was just a big lie perpetuated by the powers that be.
Yeah.
And
Yes.
animals were
And
fed hemp too, so we got hemp into our systems. Just like now we're getting those bad chemicals from animals that they're feeding antibiotics and all that stuff too.
Hmm.
Fed animals back there with hemp, and so we got those same ingredients. So our bodies are missing all of
That's
that.
right. That's
Yeah.
right.
Don't get
That's
it.
right.
Yeah. Well,
can
we're
I add just one?
go ahead. Go ahead, Dr. Kaya.
I just wanted to add one thing to that note about the hypocrisy that exists. I mean, in our history, we hear all the things that Dr. Janice and Dr. Genester told us about that has gone on in our history. And one of the key aspects was modern medicine taking over and trying to destroy natural medications and the reputation of them so that they could profit off modern medicine. And modern medicine has a lot of great contributions that we use and we should continue to use, but we shouldn't ostracize something that works so that
Yes.
people can profit. It's a money thing, and that's not how healthcare should work. And it's really interesting that we have something scheduled as a Schedule 1 controlled substance, which means it has no medical benefit, yet the government has a patent on the components of cannabis. The government actually has a program where they send out cannabis to a handful of patients. They traffic across state lines and then they incarcerate us as Black people and people of color for doing the same thing. But they got a lawsuit that said, hey, cannabis works and we're going to sue you so that we can use it. And so a few people were able to actually win that lawsuit, and they were actually able to, they're still to this day able to get cannabis from the government. So how can you tell us that it has no medical benefit, but you are treating medical patients with it every day? I mean, the hypocrisy is real. And, that's one of the things that, one of the topics that we're covering in Indica PhD, which is an organization that we actually recently founded to educate the Black community on the medicine and the health aspects of cannabis. But I think one of the ways to decrease that barrier is for us to understand the history behind it and the hypocrisy that is in
Yes.
place that, yes, it is helpful, and it's monetary reasons why you aren't using it right now. And we
Yes.
need to be angry about that. And we need to push, past that, because we are a very sick community when you look at the statistics, and we need to combat that. And cannabis just happens to be a vital tool that we can use to combat a lot of our illnesses.
Absolutely.
Well, that's some really good insight that you just shared. And if you can, let's get that link to that organization that you just mentioned, and we'll share it with the folks who are watching this program today. We got a couple of questions
Sure.
that have come in. So the first one is Delta 8 THC a type 1, 2, or 3 product?
I don't know what they mean by a type 1, 2, or 3
Well,
product, but
well, I think it was
8.
because I mentioned type 1, type 2, type 3.
Okay, yeah,
Dr. Janice, I'm sorry.
Yeah.
yeah. I don't think it's looked at that way. But Delta 8 is just a milder version of Delta 9.
Yes. Yes.
It does the same effects. You can have the same adverse experiences with it, but it doesn't sit on that receptor as long as it does, and you don't get the intensity of the side effects that you will see with THC. That's the only difference between Delta 8 and Delta 9 is where some of those different carbons are connecting. But acts exactly like Delta 9. It sits on the CB1 receptor. And when she was talking about type 1, type 2, type 3, I guess you can exchange Delta 8 for Delta 9 and still have a Delta 8 dominant product. Then you have the one mix, which is the 2, and then a cannabinoid, CBD dominant product. That just tells you where they fit versus THC and CBD, the 1, 2, and 3 designation. But you would have to just substitute Delta 8 for Delta 9.
Right.
Okay.
Right.
All right, we have some more questions too from Kyle. Would love to hear insights on cannabinoid therapy in conjunction with mindfulness for pain management.
Oh, I love that. I love that.
That's exactly
That sounds like somebody who knows a little something.
That's beautiful.
Yes.
Yes.
I do study the physiology of everything. And so when you understand the bigger picture, if you look outside the endocannabinoid system into the bigger picture, and you start thinking about other receptors that are involved, one comes to mind of the serotonin receptors. Now, what cannabis did for me as an individual, it opened my mind to everything. It reconnected the body, how important your spirituality is, how important your being aware of your surroundings are. So CBD and some of the other cannabinoids are very good at putting you to that level, including THC. Once again, these cannabinoids are promiscuous. They work on a number of receptors, including those serotonin receptors. But it puts you in a different mindset to think about things differently. And when we understand the physiology, it's a bigger picture than the cannabinoids, right? So we're getting into like things like mushrooms, all those things that let us do a better picture of just realizing our existence in the whole universe. It lets us see things from a different perspective. That's the beauty, once again, of understanding the physiology, but understanding the pharmacology of various botanicals.
Yes.
CBD plus a little psilocybin, you guys didn't really hear me say that, is wonderful. Wonderful, okay? And there's at times when I would recommend psilocybin before cannabis.
I don't even know what psilocybin is. For those, I'm not familiar with that.
Magic mushrooms. People have heard of magic mushrooms.
Yes, I know that term.
You know that term.
Mindfulness is a big deal because if you can get people's minds out of, I'm sick, I'm ill, I'm this, and get them to where they can start to think I'm healthy and well, I'm aware of my body, I'm aware of the environment, what the environment gives me, then you have a better chance of healing a person. And Dr. Wilson, you said it beautiful. You can give a patient cannabis, but if you're not correcting everything else, their spirituality, their mindfulness, their nutrition, then it's just a Band-Aid still.
Yes.
So we have to reconnect the body with the spirituality and the mindfulness and the universe. I tell patients go out and just stand in real dirt. Just connect back to
Connect in their bare feet. In their bare feet.
Bare feet. Because our shoes insulate us from the earth.
That's right.
Connected. Right. So mindfulness is huge. So, honey, thank you for asking that question. Because you got not all excited.
Yes. This might be a good place to bring up the fact that cannabis also has a biblical reference, which is a hotly debated topic, and conventional Bible scholars and other researchers mention cannabism, which is in the Old Testament, which it's mentioned in Exodus 30, and it was describing a recipe for anointing oil, and it talked about adding cannabis in there, and that's cannabis. So that was used in the Old Testament. It was around in those days, and many researchers have determined that cannabis may have been one of the ingredients in the anointing oil that Jesus used in the New Testament. Cannabis was used when the way they crucified people. They would give them this drink before their death or before the crucifixion started to kind of, yes, it might help the pain, but it also helped the mind and help the body and everything like that before death. And also cannabis has been used spiritually for a long time. There's a paper I read, Ethan Russo sent it to me, where they found cannabis in the sacred room of some of the Jewish uh, worship, houses of
The
worship,
altars.
the altars. There would be ashes of leftover cannabis. So it was used as incense and in spiritual rituals. So cannabis has a lot to do with opening the mind and getting a spiritual connection, getting a connection with the earth, connection with yourself. And it's a wonderful plant. It's a sacred plant that we should not have been so should not have been ripped away from us.
Right.
That's a
Because
common
it's
thing.
But even in ancient Chinese medicine and
Yes.
spirituality in Indian medicine, Ayurvedic, it really lets you
Yes.
understand how important this product was, this plant was.
Yeah.
Mm-hmm.
Yeah.
right.
Mm-hmm.
Because it's connection and disconnection, right? And
Mm-hmm.
creativity. I mean, people use it in meditation, they use it in mindfulness, they use it when they're trying to be creative and make their music or make their artistic projects. Because just those different variety of cannabis, not only can they work in different ways in terms of treating different illnesses like cancer or,
Mm-hmm.
lupus, or, actually making your changing, your appetite and all these other different things that they do, physically, but also those different varieties can cause you to connect and disconnect, which, helps you through spiritual processes, which helps you through meditation and things like that.
Yes.
Yeah.
Yes.
Okay. Well, we have more questions coming in from our audience. This is a great conversation here. We have Haley asking, why do you not recommend smoking? Are there no negative effects from it? And I know we talked about the ways that people can take medical marijuana. So I think she might have perceived that you said not to smoke. So does anyone want to address that?
I
Yeah,
guess.
I can start a
Well,
little bit. We
okay.
don't we don't recommend smoking for several reasons, and I think Dr. Kaya said it right, or Dr. Genester, whichever said that. If that's what you do, then yes. Here are the medical reasons why. You heat cannabis when you're smoking it to 600 to 900 degrees, and you have these byproducts that can be damaging to your lungs. You have we call them PAH, or polycyclic hydrocarbons, ammonia, and carbon monoxide. Those are the byproducts from smoking cannabis. It can be very irritating to the lungs. Now, cannabis by itself doesn't cause cancer, but I think when you combine it with nicotine, then your chances of getting cancer does rise. When you vaping it, you're only heating it to 160 to 250 degrees, so you still get some of those byproducts, but certainly not as much. So what we like to do, if we have a patient that absolutely needs to smoke, number one, we're going to recommend vaping first.
Mhm.
And what we look at when we do that, we're looking at the onset of action, right? When is it going to take effect? If I have a patient who has a hard time getting to sleep, then I will tell them, go ahead and vape, because it's going to get you going within a few minutes. And then if they need to stay asleep, then I'm going to give them another way to take your product. So they're going to probably vape and then take CBD another way, so they get that longer duration of action. But the reason why we don't promote it is because of those byproducts that are broken
Right.
down depending on the temperature you're using, which is higher in smoking and it's less high in vaping. And the other thing about smoking is most of your product is being lost to the atmosphere. Over 50% goes up in the side stream. So you're wasting a lot of it when you're
Yeah.
smoking. So
Yeah.
we don't recommend it for those reasons, but for patients, we let them, what works best for you, what's going to
Right.
get you going. So we just say we don't recommend that, but if that's the way
Right.
you're most comfortable using, we're not going to tell them not to.
Okay.
Exactly. Exactly. The same
And one
problems you
important thing
get
with
from.
that to note, oh,
I'm sorry.
I'm sorry, Dr. Janesta.
No, I was just
Go
going to say that the same problems with smoking nicotine are the same problems you get with smoking cannabis, except for the cancer risk. That has been found to be decreased. The smoke is toxic, just as Dr. Janice said. Now, the way we haven't mentioned, well, we did slightly touch on the entourage effect. That's getting all of the parts, the phytoconstituents of the plant inside you. And the best way to do that is by using a vaporizer for your cannabis, not necessarily a vape pen. Vaporizer, you use the flower, and that's how you get all of the parts of the plant without any of it being adulterated or destroyed through the processing. When you use a vape pen, it's an oil, so it's been through the processing, so you haven't gotten the whole plant. So vaporizing is a great and healthy way of ingesting cannabis. And the reason the inhalation method is popular is because you, as Dr. Janice said, you do get rapid onset. Within 1 to 2 minutes, you're feeling it, and you can go to sleep. It lasts maybe 2 to 4 hours, up to 4 hours, but you have rapid onset. So that works really wonderful.
Okay. We have
But
more.
if you are actually, I'm sorry, Heidi.
Go ahead,
Really
please.
quick, if you are actually using a pen to vaporize flower, you want to make sure it's something where you can actually control the temperature, because some of the products out there, they're, vape pens for you to vape the flower, but you can't control the temperature, and they actually go to burning or combustion anyway. So you kind of just, have defeated the point.
Yes, amen. That's right.
Okay, we have another question from Stephen Robinson. Can you address the dangers of artificial cannabinoids like spice and K2?
Stay away.
All right.
I mean, we have to say
No,
more than
no,
that.
no.
Stay away.
No.
Yeah.
Well, this is my overall thing about artificial anything, synthetic anything.
That's right.
The further we move away from what's natural, the more side effects we're going to see. And cannabis itself is not natural to the body. It's a natural substance product, but it's not natural to the body. So you see side effects with THC or high dosages of CBD. You're going to see those. But with the K2 spice, those things, that's been totally unregulated out there. So you get, products that have been unregulated. You don't know what they are. We've had deaths from them. But once again, these are synthetic products, and they have not been regulated like cannabis has. So people have abused these and sometimes adulterated them to be something else. I mean, that's what K2 and spice is, right? And so the danger signs to me, number one, it's synthetic. Number two, they're unregulated. And what have they done to these synthetic cannabinoids that they can become deadly?
That's right.
Yeah.
That's
Yeah.
Seizures, psychiatric effects, deaths,
That's
all
right.
kind of things, can come from that. So, I
Ag-
mean,
yes.
why use them over natural
Exactly.
cannabis?
Exactly.
That's exactly correct.
A great illustration of what Dr. Janice and Dr. Kaya are saying about avoiding synthetic or artificial ingredients. When we invented or created Prempro, a synthetic progestin and a synthetic estrogen, well, estrogen that's not human for humans, is when we had lots of side effects with hormone therapy. But if you use the hormone that is made by your body, the chemical structure, the same chemical structure of the hormone of your body, you don't get those side effects when it's managed properly by a physician who knows what they're doing. But so when you use artificial ingredients, the body is not used to metabolizing it. So it's going to metabolize it into pieces and parts that your body is not used to seeing. And that's why you're going to have side effects. So anything synthetic, you have to, I'd say, avoid. Even artificial ingredients in your food products, avoid them. Eat real food and drink and eat the fruit. Don't drink the fruit juice. Eat the fruit.
Yeah.
When I think about synthetic cannabinoids like Marinol or Sesamet, these are isomers of the real THC, and they sit on those receptors, and they sit on those receptors, and they sit on those receptors. Those side effects are magnified versus anandamide, which is sitting on the same receptor. It's on and off. It's on and off. It's on and off.
Right.
But our synthetics sit and sit and sit. And I like to use Cinderella and her sisters in the shoe, right? Cinderella's foot slipped right on in there, perfect. Her toes don't hurt, her heels not hurting. Those sisters get their foot in that shoe and they're complaining. Their toes are cramped, their heels are sitting up, their arches are high. That represents the side effects because their foot does not fit that shoe. It's the same thing with molecules fitting the body's receptors. They don't quite fit. So you have side effects. So that's what I tell my patients when you think about synthetics. Now, synthetics are here. There's nothing we're going to do about it. We have to teach people how to use them or when not to use them.
Right.
And that was the lesson I think we should have learned from big pharma. Then when they moved from cannabis, which they couldn't control, they didn't have predictable results or different dosages that worked. They moved to single molecular medicine because they could predict results. They could give you a standardized dose. But with single molecular anything, that therapeutic window narrows, which
Mhm.
Right.
risks are higher. And that's
Yes.
the thing with single
Yes.
molecular medicine as we evolved away from natural medicine. So my thing is, can we learn from the mistakes from
Mhm.
before? We saw what
Right.
pharmaceuticals did, where they've brought us, and they're trying to do it with cannabis as well. So
Yep.
one thing I want people to
Mhm.
understand, and Dr. Genester Wilson-King talked about the entourage effect. That's everything in that plant that's working together to modulate each of those cannabinoids and make them perform better. CBD will work by itself, but it's going to work a little bit better when you have some THC in there.
Mhm.
So
Right.
broad, full spectrum medicine means everything that's in that polypharmaceutical plant is in your product. Broad spectrum, they've taken something out, they've extracted something out, and usually it's THC. And then we have our single molecule medicine or our isolates, which is just CBD or THC or something else. You're going to need a lot more of that isolate to do the job. And we are seeing clinical complications arising from using super high doses of CBD. We see those liver changes. We're seeing things happen. And we can bring them back down and turn that picture around when we decrease that dose and add other components to it. So this becomes really important when we're talking about how we're going to talk to people about this medicine.
Yeah.
And
Well,
consider that analogy stolen, Dr. Janice.
right.
We're
That
going
was,
to talk about
that
Cinderella. Okay?
Yes.
was
Yes.
outstanding.
I love that. I
Well,
love
guess
that.
what? We're at the 1 hour mark and we're still getting questions. So if you all are okay, we'll keep going. Is that okay?
Sure.
I do like the question I see up there.
Yeah. How would it help? So would medical cannabis help alleviate the pain from lung cancer surgery?
There's
Cannabis.
actually, I mean, I think that I like that question because it brings to light a few things. Cannabis does actually help with recovery after surgery in general, in terms of healing. If you break a bone, if you go through surgery, there are components of the cannabis that can actually help with that healing process. So that's important. And some varieties of cannabis have been shown, at least in the lab, to kill certain types of cancer cells. So I think it's only a matter of time until we get to the point where we know, okay, well, this is your go-to to actually treat lung cancer, and this is your go-to to actually alleviate to help with the healing of the surgery. Alleviating pain it's very well known that cannabis helps with pain. Different cannabinoids help with pain, and like Dr. Janice and Dr. Genester have been saying already, together they those cannabinoids together help more effectively than they do alone. So I think there's a few components to that question: the cancer, the pain, and the healing after surgery that cannabis can potentially help with.
Let me answer from an anesthesiologist point of view.
Yes. Yes.
That's what we did. That's what we did. So as an anesthesiologist, if I had known about CBD, I probably would have put my patients on it a week before to handle anxiety, stress, and building up to pain, and post-op to decrease the opiate use that they may require from that kind of surgery. That's highly invasive surgery. But we look at pain in three different categories: acute pain, we look at chronic inflammatory pain, and we look at what we call neuropathic pain. Cannabis is not that great in acute pain, but this is what I would do. I would tell them you need to take cannabis products systemically, whether it's an edible or a sublingual or into your buccal mucosa. And then I would tell them also, I want you to use a topical. So I'm going to attack it from the inside. I'm going to attack the problem from the outside. And then hopefully when if they're allowed by their doctors to use cannabis or CBD or any of those, what you're seeing is that we can get their opioid use down to a quarter of what they would need without using cannabis. So we need to teach clinicians, and we need to give patients answers on how they best can use cannabis in pain. But part of it's going to depend again on the kind of pain. Not that great in acute pain. An acute injury, it's not that great. So you may need to add some opioid to it, but it doesn't mean you do not use it. But you continue to use it, so you build up that endocannabinoid system to take care of that problem. So I look at it from three: what kind of pain do you have? Is it acute? Is it chronic inflammatory? Is it neuropathic? And then once again, I will decide which cannabinoids or terpenes that are best to go into that product. And that's the other beauty of knowing the cannabinoid system. We can help product producers put different combinations of cannabinoids and terpenes together to answer a problem.
So like a customized medicine for.
We can customize your medicine. That's absolutely correct. So we can customize and try to give a patient what they need, because once again, we understanding the receptor systems that are involved.
Dr. Janice, I think you read my notes, because I was going to talk about acute pain is not fully relieved
great
by
minds,
cannabis.
Great minds.
Absolutely. Thank you.
We have to deal with this.
Thank you so much for saying that. Yes. Acute pain. Yeah, you're going to have to take those opioids, but you won't need to take as much. Believe me. But the other types of pain, neuropathic and chronic inflammatory, cannabis is great.
Great for those.
Great for those. And actually, there is no study that shows that opioids are great and effective for chronic pain. They are not. We see that clinically, and we've seen that in the research. It's not effective for chronic pain, yet we continue to use it.
And side effects are a lot higher.
And yes. And one of the other things I wanted to bring up, the pharmaceutical companies were involved with cannabis products in the 1800s and mid 1800s. And Dr. Janice is right. They did move away from it because they could control doses and things like that. But the other reason they moved away from it, because they can patent greed, because they can make money after they patent these things they created, and then they can really make money. So it was really money driven. It was money driven as well as control. Absolutely.
Well, we have another question here from Kaylin asking, what about cannabis use by teens?
Hey, Sora, Caitlin. I see that mask there.
I see that mask. Yes. Nice. Is that Delta?
So anybody? Yeah, that's Delta.
Yeah. Go ahead.
Respond to that one. Cannabis use by teens.
Sure.
Yeah. Melissa, somebody else go first.
Well, I think that, okay, so this is pretty controversial. As you all may imagine. But one mindset is the fact that the prefrontal cortex of your brain is still developing up to around age 25, 26. Right. And the fact that cannabis can actually alter that, there's the concern there of whether or not minors should be using cannabis. So as a clinician, it's not something that I recommend for teens unless it's something that it's needed medically. I mean, I don't, recommend giving your teen Tylenol just because, you want to give them Tylenol, but if they need Tylenol because they're having pain, you give them Tylenol because they're, having pain. So it all depends on what is going on with a particular person. Whether they're youth or whether, they are any age. You have to look at what's going on and weigh the benefits and weigh the risk involved. So, someone who is having 100 seizures a day, which happens, they're going to have a very hard time with development. They're going to have a lot of problems. Seizures in certain circumstances can be deadly. So, I mean, you want to give those patients cannabinoids because that is something, that is going to be life-saving for them. There's something that is going to increase their quality of life. Mm-hmm. So with any patient, you have to have an individual approach and find out, what's the best method for them.
Yeah.
Yes.
Yeah. That's
and
good.
you said it right, that it's very controversial whether you cannabis or not in teenagers. And I think you do, if you have a medical issue, then yes, look at the risk-benefit ratio. And sometimes that risk-benefit ratio is too high when you're using a conventional therapy. And I would much rather use cannabis. But I also think teenagers and babies, they all have an endocannabinoid system as well. And they're all living in this very stressful world as well. So we get a lot of kids being labeled with ADHD and all this. And I tell you, when they come to me in the clinic and we switch them to cannabis, we see those grades increase. We see their self-esteem increase. They're able to focus. They're able to apply it to college. But once again, it's assessing them on an individual basis.
Right.
My little grandsons are 4 and 6, and we have them on CBD. And no one's going to put them on Ritalin because
Right.
Ritalin and those drugs do cause permanent changes to the brain. And we're not afraid of that.
Right.
But you start talking about cannabis, oh, the brain needs to develop. Well, those same brains need to develop when you're giving them Ritalin and some of those other drugs. I'll never forget when I'd gone to University of Oregon to give a talk to the oncologist, pediatric oncologist, about the use of cannabis in their babies. And they were referring those cancer babies to me. So I went to give them a talk, and one of their instructors stood up and said, well, I'm really worried about the effects of cannabis is going to have on the child's brain. And I thought she was really brave to ask that question. So I looked at her and I said, you know what? I'd be more worried about the effects of your toxic chemotherapy on not just the brain, but the whole body. So it's a matter of reconstructing how these people are looking at things. So if I have a football player, a kid playing contact football, I want them to have some CBD to protect.
Amen. That's right. And yes, and cannabis in teens, it should be physician directed for a medical problem.
Yeah.
Other than that, up until age 25, I'd avoid the use of cannabis. But if they have a medical problem, as opposed to using pharmaceuticals, some pharmaceuticals, I would definitely recommend using cannabis without question. But for a medical problem, and it's physician directed. Parents do not try to give your kids cannabis without a physician guiding the therapy, please.
Okay, well, we have 2 more questions, and then we're going to wrap up because I think we could probably go another hour personally because
cannabis is so much to cannabis.
Phenomenal, and
there's a lot
you're giving. I mean, we're just getting comment after comment. So, one question we got from someone who pre-registered named Walter. He wanted to know if medical cannabis is addictive.
Is chocolate addictive?
How about sugar? How about sugar? On the totem pole of addiction, cannabis is the lowest.
No.
We're talking 10% or less. And the addiction is psychological. It is not physical. I mean, you'll have some withdrawal symptoms, some irritability.
Oh, we lost her.
No, we lost her.
Dr. King.
Yeah, she
Hopefully she can join back. All right, does anyone want to finish her thought, Dr. Kaya?
Yeah.
Dr. Knox?
Well, yeah, I think she, had pretty much made the statement that cannabis is less addictive than a lot of medications that are out there. So that's why it's used sometimes for opioid treatment to actually decrease the amount of addiction that people have to substances that are more harmful. So you want to get them to decrease those substances that are more harmful. So sometimes you give them cannabis so that they can decrease those medications that are more addictive and that are more harmful. But Dr. Wilson-King, I'll let you finish.
I lost my train of thought by now.
Well, I know that you all have to go and treat patients. I mean, we talked about that prior. So this is going to be the last question. This is from Cassandra asking, any suggestions for use when the medical benefits are wanted, but not the feeling of being high?
Oh, geez. Great question.
Sure. Yes. Great question. Yes.
Great question.
You do not have to be high using cannabis, even if it includes a little THC. It's all a matter of the ratio, the profile of the medication you're using. CBD works, as we talked about the entourage effect and how they work together. CBD can decrease the psychoactivity produced by THC. So if you have a higher CBD product, you won't get as much of the psychoactivity as opposed to having a high THC product, meaning more THC than CBD and other cannabinoids. So there's a way to do that, and I think that question is an excellent one. You do not have to be high to get high by using cannabis. You can avoid that and still reap the medical benefits for sure.
And what
And a
I would
very,
add, that it depends on too, the disease process that we're treating. If I have a
mhm,
patient that absolutely need THC, then I'm going to have a strategic plan to get the body
Yes.
accustomed
Yes.
to that THC. Start at a
Yes.
very low dose, like maybe
Right.
1 milligram, and work them up to where they're tolerating that dose. Because what you see happen, the tolerance, the symptomatic relief curve continues to rise as the side effect curve veers off to the side. But
Yes.
it's a strategic dosing. And then maybe I would tell them, take your THC at night.
right.
Right.
You
Right. That was
sleep
the
through
other
it,
thing. Yes.
or give it to them in a suppository if they need THC, where you can get it into the body without experiencing those side effects, right? So it's strategic use of these products to get patients to use it. And you can avoid tolerance by making sure that you have more than just one cannabinoid. So if I need to use THC, I'm going to make sure I have CBD and CBG and whoever else I need to put in there to modulate that feeling that they're going to get. But if it so happens, if we've seen this happen, well, someone want to have a cookie, the cookie feel nothing, eat more, feel nothing, and eat the whole thing, and end up in the emergency room. They end up there because when you eat it, the onset of action is 2 hours. If they don't feel something right away, they eat the whole dang thing, and 2 hours later, they're laid out,
Yeah.
right?
Right.
Once again, teaching them how to use this so you don't get those, what we call adverse experiences. We don't
Right.
want them to have that. Everybody comes in and says, I don't want to feel high, but they need some THC.
Right.
So I want us not to demonize THC.
Right.
There's ways to strategically
Yes.
that
Yes.
that you can avoid it.
Mhm.
Yes. And THC provides a lot of medical benefits as well as all the other cannabinoids. So you don't want to leave it out.
Yeah.
Just
And
teach them how to use it.
just you learn how to use it so you don't have that feeling. Yes.
All right. Well, Drs. Knox, Dr. Wilson-King, and Dr. Kaya, thank you all so much for being guests on this Conversations on Cannabis virtual forum. We're going to share your information in the comment box so that our viewers can contact you directly. And I want to thank everyone who's watching this program and listening to this program. Please don't forget to tell us what you think about this forum. Complete the survey that's posted in the comment box so we can bring other great speakers like our panelists today. When you complete the survey, your name will be entered into a drawing for tickets to an iHeart Music event courtesy of our partners at iHeartMedia. We also encourage you to go to the Florida Department of Health's Office of Medical Marijuana Use website to learn more about medical marijuana in the state of Florida. And we also encourage you to go to the Florida A&M University Mary website, which is the Medical Marijuana Education and Research Initiative that's bringing you this program today. So please check out their website. And again, thank you, doctors. This was a phenomenal.
You're welcome.
Thank
Enjoyed it.
you to
Thank
FAMU
you,
and the Mary
ladies.
product. And thank you, my esteemed panelists. Yes. Thank you for the
Yes.
honor
Thank
of
you for
being
having
among
us.
you. Yes.
Thank you for having us.
Thank you.
All right.
Okay, stop cam. How do I get